Well, welcome everyone. Grab a seat, settle in, and let's just take a collective deep breath. I want to warmly welcome you to your very first day of pharmacy school. We are about to start an incredible journey together into the world of drugs and medicines, that truly fascinating intersection where chemistry meets the human body. Think of this explainer as your ultimate pharmacology 101. I am so thrilled you're here, and I promise you, by the time we wrap up today, you're going to look at that medicine cabinet in your bathroom in a completely new light. Remember, every great pharmacist, every great medical professional starts exactly where you are sitting right now. So let's jump right in. Okay, here's a quick look at today's course syllabus. We're going to define our terms, figure out what drugs actually are, trace their origins, share some classic plant tales, dive into the modern magic of genetic engineering, and then tie it all together with a master recap.
All right, section 1, let's lay down that foundation. Before we can build a skyscraper, we've got to pour the concrete, right? Let's start with the big one. What exactly is pharmacology? In simple, everyday language, it's just the science of how drugs interact with living systems to treat a disease. It's what happens when you introduce a chemical into the incredibly complex machine that is the human body. If we break it down to its ancient Greek roots, we have pharmakon, meaning drug, and logia, meaning knowledge. So quite literally, pharmacology is the knowledge of drugs. I want you to pause right here for a second. Just let that definition sink in. Science, living systems, treating disease. This is your new professional world.
Now, I have a little whiteboard trick I love to give my first-year students to help ace those exams. It's the mnemonic PHARMA, P-H-A-R-M-A. When you study any drug, you need to know its properties, history, absorption, response, mechanism, and application. For example, think about grabbing paracetamol from your kitchen cabinet for a fever. Understanding exactly how it lowers your body temperature, that's the mechanism. Knowing to use it specifically to reduce that fever, that's the application. If you remember pharma, you'll always know exactly how to evaluate a medication.
Let's look at the two main branches of our field. On one side, we have general pharmacology. This is the theory. It's the textbook study of how drugs work on a cellular level. But on the other side, we have clinical pharmacology, which is sometimes called pharmacotherapeutics. This is where theory meets reality. Clinical pharmacology is applied directly to treating sick patients. It's that real-world moment when you, as a pharmacist, look at a diabetic patient's blood sugar levels and decide the exact, safe dose of insulin they need right then and there. So general is the how, and clinical is the who and when. And that wraps our foundation.
Section 2. Now that we know pharmacology is the study of drugs, that begs a pretty logical question, doesn't it? What are drugs exactly? Let's take a look at our primary tools.
A drug is defined as any substance used to diagnose, cure, relieve, treat, or prevent disease. Notice how incredibly broad that is. It's not just about curing a cold. It's about diagnosing issues and preventing them entirely. And hey, here's a fun fact for your next trivia night. The word drug actually comes from the old French word drogue, which just meant a dried herb, because, well, that's where all our original medicines came from. Let that resonate for a moment. A drug is any substance meant to interact with a disease state.
In your textbooks and walking the hospital corridors, you're going to hear a ton of synonyms thrown around for the word drug. To keep them all straight, just remember this catchy phrase. MMMP. My mom makes medicine perfectly. That stands for medicine, medicament, medication, medicinal, and pharmaceutical. Whenever you hear any of those 5 words, just translate it right back to our core definition. So whether diagnosing, preventing, or curing, those are the tools of our trade.
All right, my brilliant students, you've got the vocabulary down. Now let's jump into section 3 and discover where these drugs actually come from in the real world.
Long before modern chemistry, nature was our only pharmacy. The natural biological sources of drugs fall into 4 main categories. To remember them, just think big zoos have microbes. B for botanical, meaning plant-based. Think ancient dried herbs, teas, and poultices. Z for zoological, meaning animal sources, like certain enzymes. H for human sources, like blood products or clotting factors. And M for microbial, which gives us life-saving antibiotics synthesized from fungi and bacteria. Big zoos have microbes.
But we definitely don't just rely on living biology anymore. We also have non-biological and lab-created sources. Memorize this phrase: my sister studies genetics. M for mineral. Believe it or not, common drugs like antacids come from earthly minerals and rocks. S for semi-synthetic, which is when we take a natural plant compound and tweak it in a lab to make it safer or more effective.
The second S is for synthetic, meaning drugs built entirely from scratch in a chemistry lab like ibuprofen. And finally, G for genetic engineering, growing medicines using manipulated DNA. So from ancient plants to modern labs, that is where our medicines originate. Since nature gave us our very first pharmacy, let's move into section 4. It's story time. Let's look at some classic tales of how we moved from wild plants to the pharmacy counter.
Let's look at the ultimate semi-synthetic origin story. In ancient times, people figured out that chewing on white willow bark relieved pain. Why? Well, it turns out the bark contained a natural chemical called salicin. Fast forward a bit, and scientists managed to purify this into salicylic acid. Now, it worked wonderfully for pain, but there was a catch. It caused terrible, agonizing stomach aches. Enter chemist Felix Hoffmann in 1897. He tweaked the molecule in a lab, creating acetyl salicylic acid. It was much gentler on the stomach, and in 1899, it was launched by Bayer under a brand name you definitely have in your house right now, aspirin. To remember this evolution, use the phrase Willow starts aspirin. Willow to salicylic to aspirin. A perfect story with a clear beginning, middle, and end.
Okay, pop quiz time. Imagine you're walking through a beautiful wild garden. Which beautiful bell-shaped flower gives us our oldest, most famous, and frankly, most powerful heart medicine? Do you have any guesses? If you guess the foxglove plant, you hit the nail on the head. The foxglove flower gives us Digitalis, which is an incredibly potent drug used for heart failure. This trio of plant medicines is mandatory memorization for any pharmacist. I call it the MDQ, or My Drug Quiz. M is for morphine, coming from the opium poppy for pain relief. D is for Digitalis, from the foxglove plant for the heart. And Q is for quinine, derived from Cinchona tree bark, to fight malaria. Bitter bark, malaria's foe. Memorize these 3 pairings. They are the absolute legends of botanical medicine. Section 5. We've seen how plants paved the way, but let's leave the ancient gardens behind and step into the futuristic peak of pharmacology, building drugs literally from DNA.
The 2 absolute superstars of the genetic engineering era are human insulin and growth hormone, also known as somatotropin. For your exams, remember these structures. Insulin is made of exactly 51 amino acids, divided into chain A and chain B, and they're held together by disulfide bonds. Growth hormone is a much larger polypeptide, clocking in at 190 amino acids. But here's the crucial takeaway. We used to have to extract insulin from the pancreases of pigs and cows, which caused allergic reactions in a lot of patients. Today, thanks to recombinant DNA, we can safely grow perfect, 100% human insulin without animals. It was a massive, life-changing leap forward in patient safety. But how do we actually get bacteria to make human medicine? Imagine you have a pair of molecular scissors and a recipe book. We use a specific enzyme called EcoRI as our scissors to cut open a bacterial plasmid, which is just a little circular ring of DNA. Then, we copy the human recipe, the exact human gene for insulin, and paste it right into that gap. Next, we reinsert that updated recipe book back into a bacterium. Finally, the bacteria do what they do best. They divide and multiply, reading the new recipe and producing vast amounts of pure human insulin. Just remember the mnemonic CCRD, cut, copy, reinsert, divide. We literally turn bacteria into tiny pharmaceutical factories. Well, my friends, look at that. You've survived your first day. Let's lock all this knowledge in with our final section, your pharmacology master recap. Here is your ultimate cheat sheet. Pharmacology is the study of drug effects on the body. Clinical pharmacology is when you apply that knowledge directly to a sick patient to treat their disease. A drug is any substance used to diagnose, treat, cure, or prevent disease. We learned our drug sources range from botanical, zoological, human, and microbial to mineral, semi-synthetic, synthetic, and genetic engineering. And never ever forget our classic examples. Aspirin from willow bark, Digitalis from foxglove, quinine from cinchona bark, and insulin from genetic engineering. These aren't just vocabulary words for a test, folks. These are the foundational tools you are going to use to save lives every single day of your career. We've traveled all the way from humans chewing ancient willow bark for a headache to scientists molecularly engineering DNA to save a diabetic's life. You now know exactly where medicines begin, but pharmacology is a field that is always evolving, always pushing the boundaries of what's possible in healthcare. So as we wrap up this explainer today, I want to leave you with one final thought. With everything you've just learned,
Which incredible drug origin will you discover next? Thank you so much for joining me in Pharmacology 101. Keep studying, stay curious, and I can't wait to see you in the next one.